All right, it is 10:02. We'll get started. Thank you all for joining for today's webinar. This is Mass Restaurant Association partnership with the Massachusetts Health Connector, searching for affordable health insurance options for our industry. Our panelists today are Nikki Conti and Chaitra Sanders from the Mass Health Connector. We expect today's webinar to last about 30 minutes. For the purposes of this webinar, please use any questions in the chat function, and we will ask questions at the end. As a reminder, please keep all questions to generic questions. We can't get into specific plans and specific income eligibility questions. Those can be taken offline, and we'll certainly be able to address those individually. But please ask any questions. Keep them generic. Once again, thank you all for joining us today, and I will turn it over to our partners, Nikki and Chaitra from the Mass Health Connector.
Thanks so much, Steve. And thank you to all those who have joined today. Again, my name is Chaitra Sanders. I'm the Associate Director for the Health Connector for Business, and I am joined with my colleague,
Nikki Conti, and I'm the Associate Director of Public Outreach and Education on the individual and family side.
And just a little overview of what we'll be presenting to you today. We'll be presenting to you information on the Health Connector for Business that we have partnered with the Massachusetts Restaurant Association to provide information for any restaurants who have 50 or fewer full-time equivalent employees and you would like to offer health and dental benefits to them. And I'll be speaking in detail about that. And Nikki will be talking to us about options for those who might not be benefit eligible through your business and still need health insurance, and you still want to be a great employer and assist them with that. So she'll provide you with information on that for where they can get health insurance through our individual and family market. So I'm going to turn this over to start with to my colleague, Nikki, so she could just give you a little bit of an overview of the Health Connector and who we are.
Sounds great. Thanks, Chaitra. So I won't spend too much time here because essentially this is what Chaitra covered. So we'll be talking about the Health Connector for Business platform and then talking about a pathway for those individuals who aren't benefits eligible, how they can get health insurance coverage. So going right into the next slide, I want to start off with who the Health Connector is. Some people have heard of us, some may not know exactly who the Massachusetts Health Connector is, but we are the state's health insurance marketplace, and we were formed to offer health insurance for individuals, families, and small employers. So essentially, we were created, originally back in 2006 to be the platform to give people a little bit more visibility and transparency to this health insurance process. And then later on, when the Affordable Care Act passed, we were, in certain ways, we were the model for the nation in terms of a marketplace. So we are the state's health insurance marketplace. So as Chaitra mentioned, for small businesses with 50 or fewer full-time employees, you can consider offering them the Health Connector for Business plans, and we'll get into details. And then for those people who don't have access to affordable coverage, either through an employer, a spouse, their partner, etc., they can apply on the individual and family side. Now, a lot of people who apply on the individual and family side do qualify for savings. And right now in particular, there are more savings available due to the American Rescue Plan and the Inflation Reduction Act. So I'll get into that in more detail later. And then Chaitra and I always, we have to say this, so please remind if anyone has questions about dental. We'll be talking about health insurance quite a bit this morning, but please know that dental coverage is also available through the Health Connector, and someone can purchase that when they enroll in their plan, or they can come on later and buy dental coverage. So on to the next slide, lots of information here, but again, each of these items on this page, we will be going over in detail in further slides. But I think a couple of the key takeaways that we want you to have is that all of the health insurance plans that are sold through the connector offer comprehensive benefits, and these plans meet state and federal coverage standards. So including prescription drugs, hospital visits, specialists, etc. So any plan, whether you are getting a plan on the individual and family side, or as an employer, you're offering a plan through Health Connector for Business. So I won't get into all of these things now. I will be covering them, Shaitra will be covering them in detail in the slides. Now, you might be wondering, this sounds great, but what are the plans? Which carriers are participating? So all of these logos that you're seeing here, these are the health insurance carriers that are participating in the Health Connectors offerings. So actually, all of these are Health Connector for Business plans. All of these are plans that you can buy as an individual or family. And then a subset of these plans are involved in the Connector Care program. And I'll talk more about that in a bit. But know that depending on where you live, you will have access to coverage and providers within your area. So Shaitra will spend more time talking about cost savings and flexible choice offerings through Health Connector for Business. And again, I'll spend time on the individual and family side. So with that, I'll hand it to you, Shaitra.
Great. Thanks so much, Nikki. So what I'm going to talk about today is the Health Connector for Business, and that is the health insurance marketplace for small businesses located in Massachusetts that would like to offer health insurance to themselves and their employees. And that will be through the Health Connector for Business, the state's health insurance marketplace for small businesses. So when you think about the Health Connector for Business, what are some of the reasons why, as a small business with 50 or fewer full-time equivalent employees, you might want to come to the Health Connector for Business to offer health insurance to yourself and your employees? Well, since we've been around in January of 2018, we've done some surveys, both to our employers and our brokers, and we've heard back that these are the reasons why a small business would want to come to the Health Connector for Business to offer health insurance. First of all, as Nikki stated, we're a marketplace. So we're a one-stop shopping solution. We are the only place in Massachusetts where small groups can actually access all the leading insurers, those logos you saw, in one location in our online platform. Also, since we have all the leading insurers in one place, it is very easy for you as a business owner or business decision maker to compare costs across carriers, across plans. And what employers have found is that on average, they save about 20% through that online comparison shopping tool. So everything is at your fingertips, available, easy comparison online, and therefore making financial decisions where you save your business money on offering health and dental insurance. There's also ways to receive money back for offering health insurance, and we'll talk about that in more detail, but there's wellness rebates. So you can actually receive back up to 15% of what you contributed into your employees' health insurance premium by promoting wellness within your workplace, and we'll talk more about that. There's also an exclusive option called our employee choice models, and the employee choice models are actually designed for you as a business to create a budget or a cost control constant while providing your employees with choice so that they can enroll in a plan that best suits their needs. And we'll talk about that in more detail also. And just to let you know, utilizing the Health Connector for Business is free for you. There is no membership fees or dues. You just pay the premiums. And you also have certified assistants. We have over 500 certified brokers. These are independent brokers within your community that can assist you on any Health Connector for Business related item for free. And just to reiterate, as Nikki stated, all plans on the Health Connector for Business are compliant with state and federal law, and they meet minimum credible coverage standard and have received the Health Connector seal of approval for quality and value. So you have that peace of mind when you're offering health insurance to your employees. And there are a few business plan highlights on the Health Connector for Business that will possibly be really attractive to your business and your employees. For instance, our plans from the carriers, some of them have HSA compatible. So if you are offering a health savings account plan also as a benefit, which is a tax advantage medical savings account, there are plans on the Health Connector for Business that actually are compatible with that health savings account benefit that you're offering. So there you can offer your employees two great benefits. Also, if you have employees who possibly live outside of the state. They're not in Massachusetts, or they need access to out-of-network doctors. We also offer PPO options through the Health Connector for Business. And again, just as a reminder, we also offer dental on the Health Connector for Business, so you can offer health and dental to your employees. So as I stated before, one of the reasons that small businesses come to the Health Connector for Business is our employee choice models. And this is an exclusive option offered only through the Health Connector for Business. And the goal of the employee choice models is to allow for an employer to control their costs while providing their employees with multiple insurance options. And since this is an online platform, this is very easy for employees to compare the options you have given them and choose the plan that best fits their needs. So they'll be able to compare what's available, the prices, the doctors in the network, the benefits, and they can make their choice, and you can control your budget. And these are the employee choice models. They're called one plan, one carrier, one level. This is very technical health insurance speak on here, whereas I'm not going to talk in this detail. I'm going to compare health insurance to pizza. So I'm going to talk about one plan, one carrier, one level. And I'm going to imagine that you guys are going to share the cost of a pizza with your employees. So how does one plan work? First, I want to let you know that one plan is not exclusive to the Health Connector for Business. You can offer one plan elsewhere, but we offer it because it is one of the traditional ways of offering health insurance here in Massachusetts for small businesses. So how does one plan work? So imagine you and your employee decide to share the cost of a pizza. Your employee is going to get that pizza, but as a business, you're going to share the cost of that. One plan works this way. You, the decision maker, decide that your employee is going to be able to get a pepperoni pizza from the pizzeria down the block, and that pepperoni pizza happens to be $10. You look at your budget, you decide you can offer half of that, so you're going to pay for half of that pizza, and the employee is going to pay for the other half. So all your employees will be offered the $10 pepperoni pizza from the pizzeria down the block, and those who need the pizza will go ahead and buy the pepperoni pizza from the pizzeria down the block. You'll pay for half, they'll pay for half. So everyone who needs that pizza will get the $10 pepperoni pizza from the pizzeria down the block. And that's how one plan works from a health insurance thought process. You will choose the health insurance carrier that you are offering your employees, that plan from the health insurance carrier, and all your employees will either enroll in that plan because they need it or waive because they have health insurance elsewhere, and you'll share the costs of that plan. So that's one plan. One carrier is exclusive to the Health Connector for Business. So how does one carrier work? Again, you and your employee are going to share the cost of a pizza. In this case, you decide that the pizza is going to come from the pizzeria down the block. You take a look at the menu, you decide that the business can afford to share the cost of a $10 pepperoni pizza from the pizzeria down the block. Therefore, you're going to give them $5 towards this pepperoni pizza, towards a pizza actually, because you could afford it. Now your employees can look at the pizzeria down the block, look at the menu, and choose the pizza that they want and utilize that $5 you gave them towards the pizza they want. So for instance, some employees just might want a cheese pizza. That cheese pizza might only be $8. So in this case, the employee would only have to pay $3 because you've already budgeted $5 from the pepperoni pizza. Some employees might want the supreme pizza, and that pizza might be $15. Those employees would pay $10 because you have budgeted that you can afford to pay $5. So you're giving them $5 towards pizza. Or some of them just might get the pepperoni pizza and pay the other $5. But the key is they have to get the pizza from the pizzeria down the block. And that's how it looks for a health insurance carrier. So you would pick what carrier they're getting their health insurance plan from, look at the plans that are available from that carrier, and choose the plan that the business can afford to pay into with your budget. And then the employees will choose the benefit from that carrier that they need. Some of your employees might need more access to care than others. So they might want a more comprehensive plan with less out-of-pocket costs when they see the doctor and a higher premium. And others might be fine with a lower premium and higher out-of-pocket costs when they see the doctor. This allows you to let your employees choose the plan that they need from their carrier, and you can pay into the plan that the business can afford. And so, for instance, if any of you are offering health insurance right now and you're thinking about, wow, I'm maybe paying into a really comprehensive plan right now that everyone has access to. So maybe you're paying into plan A to make sure everyone has, like, maybe, really low deductibles, low out-of-pocket costs, and maybe it's costing you about $1,000. And if you can't afford that, with the one carrier, you can pay into possibly a slightly less comprehensive plan that costs the business less money. And then your employees can buy the plan that they need, but the business only pays into the plan that the business can afford to pay into. And the employees take on the rest of the share for the plan they chose. Now, one level is also an exclusive option through the Health Connector for Business. So imagine you and your employees decide to share the cost of a pizza. In this case, you decide that all your employees will have access to a pepperoni pizza. You then look at the pizzerias in your neighborhood, in your area, and you decide that the business can afford to pay into the pepperoni pizza from the pizzeria down the block. It's a $10 pepperoni pizza. You'll pay for half, and there'll be $5 towards any pepperoni pizza that the employees want. Now, the employees then look at the same pizzerias in the area, and they look at the pepperoni pizzas from all the different pizzerias, and they buy the pepperoni pizza from the pizzeria that they choose. And as you know, food of the same nature will cost different at different locations. So depending on where the employee buys the pepperoni pizza from, they may pay a different amount, but the business will always pay the contributed amount into that $10 pepperoni pizza from the pizzeria down the block that you chose. And so when you think about one level, what you're doing is deciding what benefit option all your employees will have access to, choosing one of the carrier's plans that the business can afford to pay into, and then allowing your employees to buy across the carriers and choose the one that has their doctor in the network. Therefore, allowing them to stick with whatever doctor they feel comfortable with, hospitals, any kind of access to a network that they need, even if your business cannot afford to pay into a carrier's plan that has all the doctors and all the hospitals in their network. And so what that kind of looks like here is, so imagine right now you are offering health insurance. Maybe you're paying into some carrier that has a slightly larger network. Maybe it's costing you about $1,000 right now because you're paying into one that has, a larger network. If you need to control your costs a little bit more and bring that down, through one level, you can still say to your employees, you will have access to your doctors, but the business can pay into a slightly narrower network and then allow your employees to buy across and choose the plan that has their doctors in their network, therefore allowing them to keep the doctors and hospitals that they feel comfortable going to. So that's our employee choice models, and that's exclusive to the Health Connector for Business. What I'm going to talk about in the next two few slides is ways to get money back. One is our ConnectWell program, and that's our wellness rebate program. As an employer, you can receive 15% back on the contributions you put into your employees' health insurance premiums if 33% of your employees participate in one of our 30 pre-approved wellness activities. And the employees are incentivized with a $100 Visa gift card. This ConnectWell is very easy to participate in. If you have 25 or fewer employees enrolled on the Health Connector for Business, we auto-enroll you. Every month, we remind your employees to take advantage of this, get their $100 Visa gift card. We do this through email. Once your employees complete the activity, upload it online, we send and get approved, we send them a $100 Visa gift card through the email. And once you've reached 33% participation, we notify you that at the end of the year, you'll be receiving a check back for up to 15% of what you put into your employees' health insurance premiums. And just to let you know, this is a real rebate. You will receive a check back if you complete, if your employees, 33% of them complete this. And here is one of the employers who received money back, Marcy Berger. She said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So it is actual money back to your business that you can utilize however you would like. There's also another way to get money back shopping through the Health Connector for Business, and that's the Small Business Healthcare Tax Credit. This is a federal tax credit that I don't talk too much about because this is really something your tax professional will look into. But one of the key things here for you to bring this to the attention of your tax professional is one of the requirements is that your business offers health insurance through a state marketplace for the small businesses. And we are the state's health insurance marketplace for the small businesses. So Health Connector for Business, by offering your health insurance to your employees through the Health Connector for Business, can open up this conversation with your tax professional. They will then look at the other requirements and see if you might be eligible for this 50% tax credit. But again, the key to opening this up is that you offered health insurance to your employees through the Health Connector for Business, and that will have your tax professional look at the other requirements. So really quickly, I've gone over some of these great benefits of offering health insurance through the Health Connector for Business if you're a small business with 50 or fewer full-time equivalent employees. If you're interested in getting started, what you'll do is go to the website that has been designed for your association, and is www.mahealthconnector.org/the-MRA. You'll see this wonderful landing page, and you can go ahead and create an employer account, utilize a quote, really take a look and see these benefits that I've just reviewed. It'll all be available on the page. And then just to let you know, there is no open or closed enrollment period for a small business. If you would like to offer health insurance on the first of any month, so for instance, maybe you're not ready to offer health insurance right now, but maybe over the summer you might want to, you can start your health insurance plan on July 1st. Just there are some prior months deadlines that you have to hit. So for instance, if you wanted to start on September 1st, in August, you'd have to hit these deadlines where you create an account or for your employees a health insurance plan by the 10th. Then your employees, they'd have to create accounts by the 20th of the prior month and choose their plan that they want. And then you make your online payment by the 23rd of the prior month. And then the coverage will begin seamlessly on the first of that month that you want to start the health insurance. And then your health insurance plan will be in effect until your anniversary date the next year when your renewal will go through. So you have a full benefit year. And just to remind you, even though this is a self-service model, and I welcome you to come on and do this to yourself, you can get free assistance from any of our over 500 certified brokers. They're free for you to utilize. They can put together easy cost estimates and really interview you and discuss and talk about what's important to you and your employees, budget, offerings. And then they can put together a plan for you and explain to you what they're presenting to you and your plan options, because this is what they do day in and day out. And then you can focus on what you do day in and day out, and that is deliver great food, drinks, whatever is your line of business in the restaurant industry. So I have talked to you about what is available for you as a small business to offer yourself and your employees. And now, Nikki, I'm going to turn it over to you to just let them know what's available for those who might not have access to health coverage or might not be benefit eligible through the small business.
Thanks so much, Shaitra. If you want to go on to the next slide. One thing Shaitra mentioned that I want to link to is the concept of a closed enrollment and an open enrollment period. So every year the Health Connector has an open enrollment period so that if any individual doesn't have health insurance coverage for whatever reason, they can come in from November 1 until the end of January. Our open enrollment recently ended. However, I want to acknowledge that if anyone that works for you, if you know of anyone who doesn't have health insurance coverage for any reason, we offer special enrollment periods for individuals and families. So there are things called qualifying life events that lets you enroll in or change health insurance plans outside of the open enrollment timeframe. And these are things like an increase or decrease in household size, income going up or down, somebody moving. So if someone moves into Massachusetts or moves from one part of Mass to another part of Mass, there are different health insurance plans available in that area. So all of these things, including, getting married, having a child, adopting a child, or losing access to job-based health insurance. Again, these are all qualifying life events. And what someone needs to do is report any of those events within 30 days of it happening. And then you have 60 days. They'll have 60 days from the date of that event to select a new plan. So when an individual family is in this special enrollment period, all the rules still apply about paying and enrolling, but it's just basically a window that opens. So going on to the next slide, I feel like I jumped right into like when, because I think open enrollment or closed enrollment might have been on people's minds, but on the individual and family side, there are two kinds of help that people can get paying their premiums. Now, earlier I'd mentioned that there were more savings available to people because of the American Rescue Plan, but I want to explain how those savings come to be and what the person can expect. So through the Health Connector, you are able, if somebody applies through the individual and family side, they're able to see if they qualify for advanced premium tax credits. So depending on someone's eligibility, those dollars are going to lower the cost of the monthly premium that the person pays each month. Now, the way it works is the dollars, that money goes from the IRS directly to the insurance company. So the consumer doesn't have to deal with that. All they do is pay the lower monthly premium. Now, if somebody is in a situation, let's say they're working seasonally, winter could be the slower months and they're not working at all, etc. And let's say they qualify for a good amount of tax credit, that person has the ability to choose the amount of the tax credit they want to take. So keep in mind, all of this gets ironed out at tax time, it gets reconciled, but that's one way in which somebody saves money as an individual or family member coming through the Health Connector. The other way is through the Connector Care program. And the Connector Care program uses the federal dollars plus additional state dollars, and that reduces the premium. And these plans are great plans, comprehensive with low monthly premiums, low out-of-pocket costs, no deductibles for the person. And then depending on the person's situation or their household situation and the plan type they qualify for, they may be able to choose a plan for $0 or as low as $133. So we'll guide you there if you want to, check that out. If as you're thinking about maybe you have some, let's say like part-time staff, lower wage, like earning, and you may be thinking, okay, how are they going to afford what we may consider offering? Now, before someone completes an entire application, they can go to our Get an Estimate tool that's available on mahealthconnector.org, or following this presentation, you'll get this deck and you can click directly on the link to just enter some very basic information and see where someone might land. So on to the next slide, you might be thinking, okay, well, what are the income guidelines for the Connector Care program? You can see from the chart for a household size of 2, if someone's making $51,720 or less, they could, and they meet all the other eligibility criteria, they could in fact qualify for Connector Care. You're seeing another chart to the right, and this is these were the past tense, were the income limits for advanced premium tax credits. And those were available only up for people up to 400% of the federal poverty level, so up to those amounts. Now that has been removed because of new legislation. And basically, where you'll find that now people who with incomes over these amounts could be eligible for federal help paying for their health insurance coverage. So to basically get the cost of their coverage down to a point where it's no more than 8.5% of their income. So you may be wondering, okay, like really, how does this work? What do I need to do? What do I need to know? Use the Get an Estimate tool. And you can see what somebody could in fact qualify for. You'll be surprised, a lot of people who hadn't qualified for savings before are now actually qualified. So going on to the next slide, you're probably wondering, okay, so again, who is this for? How do I do it? Like, what do they need? So they need to be a Massachusetts resident, they need to be legally here in the US, and they need to be someone who doesn't have access to affordable, comprehensive health insurance coverage. And if somebody's already enrolled in Medicare, Medicaid, or Mass Health, our state's Medicaid program, or any other type of public coverage. So for example, certain veterans benefits are considered, comprehensive. So, kind of takes these people out of the pool. And when I say, offered affordable, comprehensive health insurance from an employer, what happens is as the person's going through the application, they have to tell us whether or not their employer is offering them health insurance. So let's say they say yes. That person is likely going to come to the employer, as they should, and say, okay, I'm offered this health insurance coverage from you. I need these plan details to include in my application because it's still not affordable to me. Once they enter that information into our application, the system basically does a review. And for some people, what their employer is offering them actually is deemed affordable. And for some people, it's not, and they would qualify for an individual and family plan. So what do people need? They need social security numbers. They need any immigration documents. If they're not sure, you can click on our link and you can see samples of various immigration documents that we might need. They also need pay and income information. So here's where things vary. So if someone is a sole proprietor, they're going to need net income from self-employment. If someone's working for you, your restaurant, they're going to need copies of the last 2 pay stubs. If someone's collecting unemployment, we need to know about their what they're getting from the unemployment office. And then if people are doing gig work, etc., we basically need to understand what someone's current income situation is. And then it's always really important for me to say this. If someone doesn't have all this information that I'm talking about here, please don't discourage them from applying. We really want people to start this process, get into coverage. Once they go through the application is going to give them a result. And then it will also tell them what information they owe if we need to get any proof back from them, whether it's related to income or residency. So it's always best, I think the message is, if somebody needs coverage, simply apply. Now, I like to say, sure, people can do this on their own. I always have said it's kind of like doing your taxes. You just got to get the documents together. You've got your online application, you get your cup of coffee or whatever your favorite drink is, and you're like, I can do this. And you create an account, you start to process, answer the questions. Now you might get stuck. Somebody might get stuck along the way. And if they do, we have free help. Customer service is available at 877-623-6765. We also have all of these community partners. So similar to the brokers, we have what are known as navigators or certified application counselors. This is free help sprinkled across the state. And if someone needs help in a language other than English, many of our certified assisters speak multiple languages. So if somebody wants to find an assister near them and get some support, I just recommend right now, if you're going to do it or when they're ready to do it, just call ahead, schedule an appointment, and this link will take them to where they can find that. And on to the next slide, Chaitra. Okay, I feel like I went through a lot really quickly, but I'm really curious to get to your questions. But we like to do this slide together to essentially talk about how there are similarities and there are differences between our platforms. One of the similarities is our enrollment timelines. So essentially, we need people to look for what they want, choose what they want, and then pay for what they want by the 23rd of the month so that they can be enrolled for the first of the following month. So for right now, it's for both platforms, whether you're an individual or a business, you need to take all your actions by March 23rd so that you can have coverage April 1st. Now, Chaitra is going to be really good about giving you all the small business details, and I'll stay on.
No problem. So as Nikki said, we like to pull this together in the end, right before the questions, just to give you a reminder of what we spoke about and why we do this together. So again, in the beginning, I presented to you as a business owner, you might be interested in offering health insurance, or maybe you're already offering health insurance and you're looking for more savings options because you want to be attractive to your employees. You want to attract new employees, you want to retain employees, you want to provide benefits to them. So we are a great way on the Health Connector for Business side for you to be able to do that, to offer really comprehensive health insurance and dental insurance with cost-saving options, and allow for employees to make decisions on their own choices, and get opportunities to get money back for offering health insurance to your employees. But as we know, some of your employees might not be benefit eligible, or because they're part-time, or they're working maybe seasonal, or maybe, as Nikki stated, they're not getting as high of an income in comparison to the plan that they're being offered. So they might have access to get health insurance through another route. So for instance, we don't want you to feel like, oh, I'm offering health insurance, but some of my employees cannot get this. There are other options for them, and that is on the individual and family side. So that's why we like to do this presentation together, to just let you know, as a business owner, as a small business owner, there are ways for you and your employees to get health insurance through the Health Connector for Business on both sides. And as Nikki said, we have very, very, very similar timelines. So the 23rd is the key for both platforms. Payment needs to be made. And the as stated before, the Health Connector for Business has a few more deadlines, only because it is a business offering the employees the health insurance. So you have a timeline to hit, and then your employees have a timeline to hit, and then a deadline for payment. But we coincide with the 23rd. So even, for instance, say right now, you decide to offer your employees health insurance, and some of them might already be covered on the individual and family side. Well, if they decide to take your health insurance because it makes sense for them, choice-wise and affordability-wise, they, on the before the 23rd, would cancel their individual and family coverage. And so we definitely work very closely together. We know we've gone a little bit over our half hour, so I think, Steve, it would be good time to get into some of the questions that were asked.
Yes, we have some questions coming in fast and furious. So thank you, Nikki and Chaitra, for today's presentation. We especially appreciate the reference to the pizza and how that works for health insurance and simplifying the health insurance conversation. So let's just get right into them. The first one is, can you offer a comment, and this may be outside of your world, this may be in the regulatory world, but why is this only available to people with businesses with less than 50 employees?
Okay, so we are designed for small businesses with 50 or fewer full-time equivalent employees. And I can definitely send along the regulation, but above 50, they're considered mid-sized to larger employers. And so I believe there is a requirement for them to offer health insurance. 50 or fewer, there is no requirement, but there is a great benefit to you as a business owner to offer your employees health insurance. And we can definitely send along those links for you to see the difference between being a large business and offering benefits, and being a small business and offering benefits.
Okay, and then a couple of eligibility questions on the plan. Does an employer need to contribute at least 50% to a plan's cost in any of the different tiers?
So that's a great question. So I want to let you know that every effective date from February 1st effective date to December 1st effective date, yes, there is a requirement for an employer to at least offer 50% of we call it a reference plan, but that plan that you choose to pay into for the employee, and 33% for the dependents. If you offer to dependents, you're not required to offer to dependents, but if you do offer to dependents, you would have to contribute at least 33%. But unlike anywhere else, because we are the state's health insurance marketplace, if you can't hit those 50% contribution requirements on January 1st, because we're a state marketplace, there is actually a special enrollment period where there is no minimum contribution requirement. So maybe you're not ready to move on with 50% right now, and maybe you want to offer a little bit lower. You would start your health insurance plan for your business on January 1st, but only through the Health Connector for Business, because we're the state's health insurance marketplace, and we're the one who is allowed that special enrollment period through the Affordable Care Act.
And that is a self-certification, or is there a sub process on that where you would need to confirm that on those type of plans?
So as long as you're a small business with 50 or fewer full-time equivalent employees, and you come onto our platform for a January 1st effective date, you would set your contribution percentages.
Okay. Second question talks about employee eligibility. If I offer this plan and I offer it to one available person, am I able to distinguish between part-time employees and full-time employees? Am I able to set standards within my plan to allow different employees to be eligible?
So the requirement is that you offer to at least all full-time employees. So those working 30 hours or more must be offered the plan. And at initial enrollment, one of the requirements is that you upload a wage report or a recent payroll. And you have to notate who is full-time and who is part-time. And those who are full-time must be offered the health insurance. They don't have to take it. They could waive it if they have health insurance elsewhere. But all full-time employees who work 30 hours or more must be offered. If you offer to part-timers, that's your choice, but then you offer to all part-timers.
Correct. This one is hyper-specific to the restaurant industry. We have a lot of tipped employees that at the end of the week have a $0 check. What is the process in place to be able to collect the premium from that? Am I allowed to bill the employee in the previous month? Am I allowed to bill the employee post-month? How does an employer collect the employee's percentage of the premium with tipped employees getting cashed out at the end of the night?
So that I would not be able to tell you just because I don't work on that part. You will be invoiced every month for the full invoice. And then you are, as the employer, required to pay that invoice. How you set up payroll deductions would be between you and your payroll department, or if you need any legal advice, that you would go to whoever's your legal person. But we just have to notate that you, as the employer, are responsible for paying the full invoice, and then you deduct the payroll as you've set up with the payroll department.
And just an MRA comment, yes, you are permitted to invoice the employee for that. And please reach out to us so we can talk about that situation.
Thank you, Steve.
A kind of a income eligibility question. Roughly speaking, if someone makes about $80,000 a year, the premiums don't seem much better than the open market. Is that true? Is there income limits where the more an employee is making, does the value decrease with buying insurance on the connector, or is it kind of similar conversation?
So I just want to know, on the Health Connector for Business, we don't look at incomes at all. That's employer-sponsored coverage. So you're just offering plans, paying into it, and they're just deducting from their premium. But I'll let Nikki talk about if they're not going through the employer-sponsored coverage and getting it through the individual and family side. That's where income is looked at.
Yep, that's where income comes to play. But Steve and Chaitra, if you guys could reframe the question in a different way for me, because I'm trying to follow the connection between income and the type of coverage.
So it's on the high or the mid to higher income employee, not the lower income employee. The way I read the question is basically, if you go out on the open market outside of the Health Connector and you are going to buy insurance as you traditionally would, the premium amount seems to be about the same.
Yep, that could in fact be true. So as someone's income goes up, they may actually be in the same situation as coming through the marketplace. So as their income goes up, they may not qualify. So there are people who qualify for zero tax credits. So yes, they could buy either through, they could buy on the open market or buy through us. What is helpful is essentially just the transparency that we're able to offer on the marketplace. So even if a consumer says, you know what, I'm not going to get any subsidy, there's no reason for me to go through the Health Connector. I always like to say, well, as a taxpayer, this is your website, so use it for information. use it to make sure you're getting the health insurance coverage or the health insurance plan that's going to meet all your needs. We have different tools, we have provider search, we have all these things that a person can use. So even if they choose to go directly to the carrier, that is fine. Because any plan that we offer on the marketplace is also available from the carrier. It might be a slightly different benefit design, but essentially one of our goals is also just to make sure people are covered. So
I would also add that you're likely to not have the Live Well discount available as well, although there are some physical education discounts available on the open market. That particular one that's available on the Healthcare Connector is not available. So that's my comments on the two different plans on the open marketplace and the Health Connector marketplace.
Yeah, and the ConnectWell, just to confirm, that's through the Health Connector for Business. So technically, if you offer an employer-sponsored plan, that person making that certain income shouldn't even, wouldn't even have to worry, because they wind up taking the employer-sponsored coverage with the contribution. But if you're not offering and they need to access it elsewhere, is as Nikki said.
Correct. I think we have time for two more questions. One more question is, are there resources for employees to help them navigate what plans they might want to choose within the different tiers? We don't have the ability to explain what networks, what might be covered, what wouldn't be covered. Are there resources through the connector that's available that we could refer employees to once we've made the decision to go into the Health Connector plan?
Yes, I love the employee shopping experience. I have to be honest with you. Once you as an employer offer the health insurance, as long as you put their correct emails, they're all sent an email that says, create this employee account, take a look at what you've been offered. Well, actually it says, congratulations, your employer is offering you health and dental benefits. And then it gives you this access to really review the plans that are offered to you. And there's ways that they can comparison look at how much is going to cost them, comparison look at how much is out of pocket at time of service, take a look at their provider directory to see who has their doctors in it, take a look at formularies. There's links for them to actually review right from the carrier's website, their summary of benefits and coverage, the coverage area. It is very easy for an employee to compare what is being offered to them and review and make a decision. And obviously they can also always call the customer service number if they need a little bit more assistance. Customer service can't tell them what to get, but they can always tell them how to find the information they need. And if you're working with a broker is always very useful, because they can educate the employees also on what they might need based on the discussion that they have.
Okay, and one other question has come in. Eligibility question: if I'm offering insurance through the Health Connector, the existing employees that I have that are on Mass Health, are they now disqualified from Mass Health, or is that an income eligibility question still?
Saitra, can you talk about the waiver first, and then I'll talk about Mass Health?
Yep. So when you offer health insurance to your employees and they go in and they make their account, if they have health insurance anywhere else, that is a valid waiver. So they can utilize that as a waiver. And then Nikki will speak about what they should do with their Mass Health application.
Yep. So if you have employees who are on Mass Health, so we don't work for Mass Health, but we work very closely with them. So we'll certainly send this link to Steve, and Steve can share it with all of you. But basically, Mass Health has a program known as Premium Assistance. And that is to help encourage employees who are on Mass Health to enroll in the employer-sponsored plan, and then Mass Health will help pay the premium for that person. So we're happy to share that information with you. And for the employer, their only responsibility, so yes, they indicate they waive on the HCB side, the Health Connector for Business side, but on their state application, they just should be updating the application to indicate that they do have an offer of they do have an offer of employer-sponsored insurance.
And this may be a question for an individual broker or individual healthcare connector resource, but I'll ask it and you guys can make that decision.
Okay.
Can an employer enroll now at the 50% contribution level and then re-enroll in January under a lesser contribution?
It is called, yes, it is called an off-cycle renewal. Technically, what it is if you started April 1st, which is what is coming up now, the deadlines, you would have a health insurance plan benefit year up to 12/31/23. During December, what you would do is you would request, it's called an off-cycle renewal. And really what you're doing is you are ending your current benefit year early, and you are starting a brand new benefit year on January 1st because you want to change the contributions. Just keep in mind, any monies towards deductibles or out-of-pocket costs, the maximum out-of-pocket cost, would just end on the 31st of December, and it would just restart on January 1st. So you just want to be very careful when you do put into play the thought of creating an off-cycle renewal, because it is a brand new plan year, as if the other one just ended early.
Okay, we are at 52 minutes, so an incredibly beneficial amount of time spent. Thank you very much, Nikki and Chaitra. For everyone out there, this will be recorded and placed on the MRA website for future information. And please visit www.mahealthconnector.org/the-MRA for dedicated assistance for MRA members. Thank you all for joining today, and this concludes today's webinar. Thank you.
Thank you.
Thanks, everyone.